Hi, I'm Dr. Heather Moore, owner of Total Performance Physical Therapy. Today we're going to talk about can plantar fasciitis cause knee pain? And the answer simply is yes. So what happens is anytime you change how you walk, you are going to be affecting the other joints in the body. So anytime you are limping for whatever reason, you're going to change how your knee reacts, how your ankle reacts, how your hip reacts, how your low back reacts. So many people don't understand that this is a whole connected chain. So you can't really do one thing at one joint and not affect all the rest of the body. So with plantar fasciitis, and if you don't know what plantar fasciitis is, it's usually the inflammation on the bottom of your foot. Very painful in the morning to take the first couple steps, and usually better throughout the day. So you're going to most often, or most likely, limp in the morning. So when you get out of bed, those first few steps are going to be pretty painful. Now, if you let it go for a while or it's really bad, it's going to take more than those first couple steps to loosen up. So in this limping process, you're going to use both knees differently. So you're going to put a little bit more weight on the other knee, put less weight on the knee that has the plantar fasciitis side on it. And what actually happens is this changes how all of these muscles start to function. So the muscles are going to protect you as much as they can. So if you have pain on the bottom of your foot, pretty much everything up here is going to go rigid. Just trying to stop the pain, not allowing you to move your foot like you would normally to limit that pain. So in that changing of how you walk, you change how all the muscles work at the knee. That changing of how the muscles work at the knee causes that knee pain. So if you leave it ignored, what can happen is you can actually change how your knee joint works, so to speak. You can wind up with a stiff knee joint that doesn't really move, and then that's a much more serious problem than just some muscle compensation that you get from plantar fasciitis. But usually plantar fasciitis, people ignore it until it gets really bad and starts to affect the ankle and the knee and the hip. So what can you do when this happens? So you want to try and stretch all the muscles out as much as you can. And if you have not gotten treatment for plantar fasciitis, that's the first thing you should do, because the knee pain will not resolve if you are continuously limping, or even if it's the first couple steps in the morning. And I know most people think it's only the first couple steps, but most often if you have pain on the bottom of your foot, you're really limping the first couple steps in the morning, and then you're slightly limping the rest of the day. So it's not something that really goes away. But if you haven't gotten that treated, you want to do that. But things you can do is you can just stretch your hamstring. All right, so we can do this standing up. Just going to pull your toes up towards your nose, and then hinging forward at the hips, bend forward. This is going to feel a stretch up the back of your leg, down into your knee, down into your heel. Okay, that's a good stretch to do to hit that knee, a muscle that connects at the knee and down at the foot. You also want to make sure that you are, again, stretching that plantar fasciitis. So one of the things that you can do is just come up on the balls of your feet and hold that stretch. You should feel a stretch going up the back of your foot. All of these stretches are 30-second hold, 6 times. And as with any foot injury, knee injury, you want to make sure you're wearing sneakers, so that way you are able to have a supported step each time. Barefoot, flip-flops, heels do not give you any support, so that means your heel, bottom of your foot, and all the muscles are absorbing the force of that step. And then the final stretch that you want to do is you actually want to stretch out the front of your foot. So you're just going to bring the balls of your foot under. You're going to feel a stretch up the front of your foot, up into the front of your shin. You're going to hold that 30 seconds, and you're going to do 6 of those. Okay? Really trying to focus on stretching out that ankle, but stretching out some of the muscles that go from the ankle to the knee. It will not resolve if you are continuously limping, even those first few steps in the morning. The knee pain will continue to get worse, and it will develop into hip pain. So it's not something you want to ignore. If you have knee pain, if you have hip pain, it means you've ignored it long enough. You've ignored it long enough so that the muscles have changed and they're now causing you pain. If you or someone you know has knee pain or plantar fasciitis and wants a free consultation with a doctor of physical therapy, all you have to do is call our office at 215-997-9898, and we'd be happy to get you in. Thanks and have a good day.